Well, Laura, let's jump into this. And I'm really excited about some of the conversations that we're going to be having today, and really looking at what we talked a little bit yesterday about it, and this whole concept of what works in wellness. And of course, you had a book back in 2000 and what'd you say, 12?
15.
15. Thank you. And it was a great book. I actually have it somewhere amongst my library here, and I really did enjoy reading it. And it was such a great opportunity to kind of, get into the head of Laura Putnam beyond just banana beer bread. And so kind of talk us through, where was your inspiration from 2015? And then let's talk about what you have seen since 2015 to 2023, January 10th, 2023. What have you seen? And again, I'll even throw this little piece into you. What did you miss in your book?
Well, first of all, this book was kind of a nod to all the conversations that we heard back then, and frankly, that we continue to hear, but I think less so, which is this notion that workplace wellness doesn't work. And the real, in particular, there was the New York Times article that came out in 2014, and it was titled, "Do Workplace Wellness Programs Work? ? Usually not, period." And so this was meant to be a response to that conversation and to clarify, okay, yes, you're right, workplace wellness programs that suck, they don't work. But that does not mean that workplace wellness does not work across the board. And in fact, we have this incredible opportunity, which is to leverage every workplace, which, as a reminder, this is where most of us as adults are spending the vast majority of our time, whether it's in person or virtually. We have this opportunity to leverage every workplace to promote better health and well-being for all of us across every community, across our nation, and across the world. So let's talk about what actually makes workplace wellness work as opposed to workplace wellness not working. So what we know very high level is that just putting a check the box wellness program where you have to fill out a meaningless HRA that's not in any way connected to the work that you do, that you have these silly programs that also are not connected to the work that you do, or that you may have these great programs, but meanwhile, they're disconnected to the larger culture. And so you have this disconnect between how we do work in general. We work in an environment in which toxicity is tolerated, in which everybody is chained to their desks, in which well-being is not a way of life. And then we have these programs on the side that have nothing to do with how we do work. Those are the kinds of things that are real indicators of workplace wellness not working. And frankly, we continue to see this over and over again. So what does make workplace wellness work? And that's what this book was all about. How do we actually get it to work? And so I would say the overriding message was, instead of starting yet another program that is disconnected from life as usual when we're at work, let's talk about starting a movement in which we shift our mindset from expert to agent of change, and we channel our inner Oprah, and we think about starting a movement of well-being in our organization. And we do things like we help people to imagine what's possible. We look at multiple dimensions of well-being and wellness. We uncover the hidden factors. That is, we take a deep dive into the culture. We look at, is this culture likely to support our well-being efforts, or is it likely to undermine them? We help people to start with what's right, as opposed to just diagnosing everything that's wrong with them and then, quote, fixing them. And then after we've started this movement, then we're going to build the movement. And we're going to do that by taking a Da Vinci approach to change, in which we take a multidisciplinary approach to tackling this issue. We involve everybody across the organization. And we go stealth, in which instead of having standalone wellness programs, we incorporated it into everything that we do. And we use non-wellness language that's more likely to engage people. people, like we talk about things like energy. And then we look for ways to really make this movement last. And that involves things like creating meaning. So tapping into our deepest human psychological needs, like the need for connection and autonomy or purpose. And then we talk about how we can, you know, design nudges and cues where we start to optimize the environment and the culture so that well-being just becomes a way of life. We don't even think about it when we come to work, whether it's in person or virtually. It's just a way of life. We launch and iterate. That is, we experiment, we try things out, and then we change. And then we go global. We look for best practices around the world. We incorporate them into our efforts. That's the book in a nutshell. You start the movement, you build the movement, and you make it last. Now, to your final question, which is what would I do differently if I were to write it again? I would say my biggest whiff, hands down, and this is something that you and I talked about, is which is ironic because in my previous work as an urban public high school teacher, which I speak about in this book, that I bring a teacher's sensibility to tackling this issue around how do we get these wellness efforts to actually work in the workplace. I really missed out on talking about the importance of looking at well-being and wellness at work through the lens of diversity, equity, and inclusion and belonging. That was a huge whiff. And, you know, as an urban public high school teacher, I was thinking about this all the time. I was thinking about things like the achievement gap. Why is it that some students are performing at higher levels than others? We know that it transcends just individual effort. That instead there are some systemic issues that are at play. And so one of the things that I have been doing since then is looking at this issue of wellness privilege. Do you have wellness privilege? So for example, do you have access to nature? You know, one of the tips that we often hear is get out into nature to improve your health and wellness. Well, let's consider that 100 million Americans don't have easy access to decent green spaces. So these are kind of the bigger conversations that we need to be having. And I whiffed on that, Chuck. And if I were to do it again, I would speak a lot more to that.
Well, and I appreciated you even your comment yesterday about the fact that you mentioned the fact that National Wellness Institute has been talking about it for a long time. You know, long before just even 2019 and 20, when it really became a major issue. So, and I wanted to, yeah, I'm plugging my own organization here, but this was long before I even came here. And so I really do appreciate that. By the way, all I can think about, and I've been wanting to do this ever since you said it, is I'm going to do my inner Oprah. You get wellness, and you get wellness, and you get wellness. Sorry, I had to do it. Somebody else, and again, I had a great opportunity to speak with the late Dee Eddington, another one of my biggest mentors in this space. And Dee said it so succinctly. Wellness works. How you're doing it is where the failure is. And it really does become that, because if you look at the 2013 RAND study, it'll flat out tell you wellness works. Yes, if it's wellness alone, it might be 50 cents to the dollar, but you add it to a comprehensive chronic disease management program. The chronic disease management program goes from 2 to 1 to 3 to 1. If you even look at the Chicago study with Dr. Beaker and Dr. Song, the Illinois study, if you talk to them behind the scenes, what they'll tell you is the $200 a person program actually yielded the organization $287 per person. So it was a net yield of $87. The problem was they were told that they had to identify it based on your $10,000 healthcare costs. And an $87 fix is definitely not anything, you know, you have to say flat out, that is not going to move the needle on healthcare. Heck, that's not even getting near to your own deductible. So these are the kind of things that we've really got to continue to fight. And you really started that great fight with the book back in 2015. And I've continued to use those kinds of facts. But this is where we've really got to start to understand those soft data numbers, you know, the happiness reports and things like that, but then turning them into the hard numbers. And in the workplace setting, we're talking about recruitment and retention. We're talking about absentee data. We're talking about hard numbers that truly affect an ROI. How are you seeing that happening in some of the companies that you're working with, and maybe even in some of your own areas?
Well, I think one of the things that has been an enemy for us is that it's so obvious that well-being is good for people, it's good for the bottom line, and it is essential for building a high-performing team. So you give me any metric that matters to your organization or to your team, and I will show you how it connects to well-being. So whether you're talking about retention, those employees who are not just surviving or not struggling, but are thriving at work, are 81% more likely to stay. Or you consider that 3 studies in a row, including one by Jessica Grossmeyer, found that those companies that invest in comprehensive well-being programs, they outperform those companies that don't. So there is just study after study, or for example, NIOSH has done extensive research showing that there is an unequivocal connection between safety at work and well-being. And on an individual level, it is so apparent. I mean, the quote that I love is that the bridge between despair and hope is a good night's sleep. It's so obvious that these basic lifestyle things that we've been talking about, that we know so deeply on a personal level, that if we're not eating well, if we're not getting enough sleep, if we feel disconnected from others, if we hate our job, if we, if we're in a crappy relationship with our spouse, we can't perform at the same level that we would otherwise. So this stuff is so obvious. And there is so much data showing that lifestyle goes hand in hand with better health and well-being and performance at work. So the data is there, and it's just a matter of how do we translate the data, and also how, in a way that that leaders are going to pay attention and they're going to put it into action, but also how do we translate common sense? It's common sense that if you're healthier and happier, that you benefit personally, your team benefits, your family benefits, your friends benefit, your community benefits, and so does your workplace.
Yep. We also got to remind ourselves over and over again that we got to fight the Excel worksheet battle. And what I mean by that is literally, you've got to make sure that you understand that the things that we're talking about here don't show up on your financial statement, but they do. And if you do it right, it's amazing how you can make those differentials matter. It's something, but we've got to get out of this mindset that we can reduce our healthcare costs by a wellness program. No, we can't, but we can manage it better, and we can identify some very specific metrics within the healthcare plan or within the healthcare issues. Like, so for instance, emergency room utilization when it's a non-emergent event. Those are the kind of things that we've really got to do. But if we're talking about it holistically, you got to remember, we're talking about a utilization rate has gone up about 0.1% over the last 20 years. Healthcare costs, on the other hand, have gone way up. And unless anybody here is working for like drug manufacturers or hospital systems, and some of you are, we don't have a whole lot of influence on what they're going to charge on their medications, that they get to charge whatever they want to do. So these metric pieces, Laura, is definitely an area that we're really starting to hone in on a whole lot better, and really starting to kind of identify some very key pieces. And I'm hoping over the next 6 months, as we really use this theme of activate in 2023, really becomes a critical success factor, so that all these wellness practitioners, everybody that's dealing in this space, really understand what's going on. What are some tips that you would give people on that?
Well, I think the first is that you change the conversation from just one of strict ROI cost containment to one about value. What's the value and of well-being at work? And one of the things that we're seeing with the Great Resignation and now quiet quitting, and by the way, quiet quitting is really just a new kind of marketing spin on disengagement with work. Which is people are voting with their feet, and that is, they want well-being, and not not well-being in the sense that I go to work and I have to fill out a scary health risk assessment, and I have to submit myself to these biometric screenings, and then I have to be told all the ways that I'm unhealthy, and then I get fixed. But it's more that I feel a deep sense of belonging when I come to work. I feel like that the organization that I work for actually cares about me. I feel like my boss has my back. I feel like my team members really see me and appreciate me, not just for what I do, but for who I am as a human being. I mean, this is, what I see as a trend from wellness to then talking about well-being, and to now human being. And it really transcends just talking about, we're not just talking about multiple dimensions of wellness, which not, by the way, National Wellness Institute, you all have been speaking about this since the 70s. Let's be clear, right? We've known this for a long time, and the name has changed from wellness to well-being. They're the same thing in my view, which I know National Wellness Institute believes as well. But now it's really about, let's not just go broad, but let's go deep, and let's make sure that our deepest human psychological needs are met when we are at work. So again, those things like the need for autonomy, the things, need for competency, I feel appreciated for the great work that I do, the need for social connections, the need for purpose, and also, frankly, the need for play. So all of these are the kinds of things that people are demanding. And I think that organizations and leaders recognize, holy cow, we cannot compete anymore in for top talent if we are not meeting people where they are at. And if there's any silver lining from the pandemic, it is that, oh yeah, health and well-being actually do matter for the bottom line. I mean, if you're not healthy and you're not well, everything shuts down, as we saw with the pandemic. So I think there's been a giant awakening around the importance of health, wellness, and well-being, and even human being at work.
But at the same time, Laura, this space we call wellness, well-being, this industry, it's still a bit of a wild, wild west. It's I always talk about wellness is being used by everybody from carpet cleaners to cardiovascular surgeons, and 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 how can we start to, and I'll say it this way, how can we get out of this talk and get into this action? To me, going from wellness to well-being is just more talk. It's somebody being able to slap more lipstick on the pig that they've been running with. Now they can call it wellness. It's like Cheerios now with 33% more, honey. It's a marketing scheme, it's a promotion scheme, and it's, in my opinion, it's a black eye on the professional standards of our space. What can we do? What do you think we should be doing to get this going from I'll say it this way, from a term to an industry?
Well, I kind of disagree with you. I think that it is an industry, and I'm actually heartened by the fact that so many people are talking about it. Maybe they're not talking about it perfectly, but at least they're talking about it. Leaders are talking about it. That, there was a recent forum with CEOs, and in the Fortune CEO Daily, you have CEOs who are being quoted as talking about how well-being is now a strategic priority. I see all of that as a lot of progress, and I am one that really fully embraces that. Let's let go of trying to have everything be so evidence-based and so perfect, and that we get the respect that we need. I'm just happy about the fact that so many people are talking about well-being, and if they're going to do it imperfectly, good for them, because it's really all about let's get started. And this is as opposed to being held back by trying to do it so darn perfectly. And this is really where I came out in Workplace Wellness That Works in my first chapter around, like, yes, we need to leverage the expertise that's out there. Yes, we need to be evidence-based. And at the same time, we need to really think about bringing everybody in. We need to take a hard look at why these influencers are having so much sway over people's engagement or lack thereof with well-being. And I think we need to really be learning from them, as opposed to expecting them for them to adopt our way of doing things and to adopt our frameworks. What can we learn from them so that we can have more influence?
I love that answer. Thank you, Laura. That was such a phenomenal answer to my question, and I just cannot say thank you enough for that. So great. All right, we got some questions from the chat group, and there are a lot of them. We're gonna consolidate. Don't worry. You know, somebody's asking, the ever famous, what company? Why are companies still trying to manipulate people with money using misguided incentives? With a negative effect. This is what I know right up your alley, which is why I picked it first. Talk to me. What's your take on incentives? What's your take on, if we're using them, how do we use them, and where do we see the future of this piece of the world come into play?
It's such a great question. And I think that we really need to ask the question, what is the benefit of using incentives? So I want to start with the example of reading. So I'm assuming a lot of people here have children, and everybody wants their child to read, and to not only read, but to love doing it. And so if you want your child to not love reading, then the best thing that you can do is to incentivize them, to say, I'll pay you if you read your book, your bedtime book. In fact, there's some really interesting research showing that there is an inverse relationship between the two. If you want to diminish your child's love of reading, then pay them, then use incentives, then tell them, oh, you don't have to do your household chores if you read instead. It has an inverse relationship. So the same is true for adults, that yes, incentives may at best get people in the door, but they will never keep them there. And that is where there is universal agreement. And in fact, it may have a perverse effect, like, oh, you get an incentive if you get more steps on your device. And so put your device on your dog to get those steps. People are going to game the system. Or, one friend of mine admitted to me that she put her device in the dryer to, to rack up more steps. I mean, this is just human nature. And so the real key is, again, we are all hardwired around these universal needs. And we have to think about more meaningful ways to connect to those deep universal needs. And the truth of the matter is, it actually requires a lot more work. It's really easy to develop a check the box program and then attach a few incentives to it. And you may initially get a push of people coming in the door, but you don't get lasting change. And B, you're likely to have people lose interest and have numbers actually go down over time. So it's the hard work, not only in terms of creating programs that people actually want to be part of, as opposed to having to be paid to be part of. I mean, think about it. If you're saying, we're going to pay you to participate in these programs, then people are going to think, wow, these programs must really suck, because they're telling me that they're going to have to, they're so bad that I get paid to participate in them, as opposed to my actually wanting to participate in them. But then the part two of this is the hard work of actually looking at some of the larger at play, some of the structural issues that are at play, like overwork or toxicity tolerated, that are actually driving a lot of these well-being issues in the first place, that are making people unhealthy, unhappy in the first place. And so is the organization willing to do the hard work and look at some of those deeper structural issues, as well as creating programs that people actually want to be part of?
It takes me back to, in fact, it was some of my sister's former students when they had their master's in wellness management program at Ball State. They did a whole program on incentives. And I remember the one statement that stuck in my head over and over again. Thank you for my $50 today. Where's my $50?
Yep.
And
Yeah.
that is exactly the kind of mindset that incentive-based programming really does start to create. By the way, if anybody really wants to learn about the power or unpower of incentives, read Dan Pink's book, Drive. Best book I've ever read on motivation. So
Can I just say one
yeah,
thing about Dan Pink's book, Drive? I mean, that to me is a perfect illustration. Dan Pink is not an expert.
right.
However, he's an excellent translator. And so that's what we need to be thinking about is we need to be excellent translators and communicators of this fabulous research that's out there. And so we can learn a lot from people like Dan Pink.
And like you said, quit using industry speak. Get it down to that layperson's wording. That's such an important part. So, hey, another quick, great question. Would love to hear some more specific examples of safety in the workplace and the correlation to well-being. I'm going to start. A fit employee is a safer employee. Da 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 da. Where's your take on how safety in the workplace and the correlation to well-being is?
Okay, so let's just start straight out of the gate. This is another no-brainer.
Yeah.
I mean, no-brainer. So let's just start there. Then I want to share a story with you, which is I worked with a company that in 1 year had 5 fatalities on the job. 5. And in one case, it was a gentleman who walked into an empty elevator shaft. This is a heartbreaking example of what presenteeism can actually look like, which, as we all know, is the biggest cost associated with poor health and well-being at the workplace, which is I show up, but not really. And in fact, it costs the company more when people show up, but not really, than if they were to just stay at home. So when I think about this gentleman, was he distracted by financial stress? Was he distracted by maybe he had a really bad fight with his wife that morning and he was thinking about that? Did he have a heart attack? We don't know what happened, but this is an example of just how much safety and health and wellness and well-being go hand in hand. And again, this is something that we all have experienced on a very personal level when we get into our car and we've been drinking, so we're not well, or we have not gotten enough sleep the night before, then it is a danger to ourselves and everybody else on the road. Again, no brainer. We know this. And so when you go onto a work site, you're operating machinery that is much, much more complex than a car. And so again, this is so self-evident as to what the connection is that I don't even know why we're speaking about this because it is so self-evident. But if you want the evidence, then go to the total worker well-being research that has been conducted by NIOSH, in which they show again and again and again that yes, the two go hand in hand, that you must be well and you need to follow the safety protocol. And that the more you do those together, the more likely you're to benefit both.
Yeah, Cha-Cha Chang did a great job at our conference last year on this exact aspect of it. NIOSH is really doing some phenomenal work on this. Our conference this year is actually in Cincinnati, Ohio. And for those of you who don't realize it, most of the data wonks for NIOSH are actually in the Cincinnati area. And I've had a good fortune of working with a few of them over the course of the last 10 years and so, and they're just doing such great data work for us. But it also it boils straight right down to, when you think about it, not only if you can make somebody safer, especially at work, one of the best things that I have done, and I've seen this done very well, but only a few people do it, is taking a look at your healthcare data and specifically looking at the soft tissues, neck, back, knee. And you can correlate a lot of your future workers' comp costs on that specific data. You can practically pinpoint the people that are going to cause you workers' comp costs. And for those of you who have never worked in the workers' comp space, understand that what's happening this year is actually going to affect your workers' comp rates 3 years from now. So you want to talk about being able to save future dollars. There is nothing better to do than to concentrate your efforts on making sure that people don't hop on workers' comp. So what a great opportunity to really kind of make that thing, make it really move to the next level.
And Chuck, if I can just say really quickly, I mean, I think that most of the people on this today are well-being practitioners, or what I characterize or wellness practitioners, or what I like to characterize as the activators. I call myself an activator. And the real question is less about whether or not there's evidence, because we know that the data and the evidence is there, and we can spin it and respin it again and again and again. But one of the things that I really urge fellow activators to think about doing is not just delivering the information, but actually persuading the person that you are trying to move on this. So when we're talking about those decision makers, often the data doesn't move them, but the stories do. So it is very intentional that in responding to your question, for example, that I started with a story, which is a story about this gentleman. So I often urge fellow activators to not only build your stat book, we are so good at that, but actually to build your story bank. And do you have powerful stories that are ready on hand to share? And again, this is about channeling your inner Oprah. Oprah is awesome at sharing stories. And by the way, when Obama ran for president in 2008, they actually, his campaign, they actually studied Oprah. What does Oprah do to be so influential? So we can be like Obama and not be too proud to study somebody like Oprah, to understand how it's not just about being knowledgeable, it is about being influential. So how can we be more influential?
WWOD, what would Oprah do? Sorry, had to go there. Yeah, I love that. And it really does start to correlate. And now we can really start to get into it, these last, say, 10 minutes or so, we can really start to kind of correlate some of the activator pieces. By the way, I took the Gallup Strength Finders, my number one activator.
Oh, cool.
So I really like, and again, I'm kind of throwing a whole bunch of questions together here. One of the things that I keep seeing over and over again is just, again, they want to go back to the data. And to me, I think one of the things that we've really got to understand is we can point to a lot of research to show that it works. But I always point to the diabetes prevention program that's got $100 million spent on it and how much of a failure that's been. And it is simply because the stories weren't right, the actions weren't right, the activation strategies, the whole picture was wrong, all the way from the top to the bottom. It wasn't that the research wasn't there, it was just that they didn't have a good practical application model. Talk about how we can start to kind of build some practical application models so that we can take that healthcare data and showcase how our cooking classes and our Zumba classes and some of these other soft data things are affecting positively some of these opportunities, but through story. And I love that idea, Laura. Talk to me about how you have seen that being successful in workplaces, especially to the C-suite.
Well, I want to make sure that I'm fully understanding your question, but at the outset, one of the things that I think that is helpful to do, and one thing I do a lot, is to not just study what, but study who. Not just study what, but study who. So who are some people who are doing it really well? So we've talked a lot about Oprah. Another one to mention is Yvonne Chouinard. I mean, come on, amazing, right? And I love how he came out with a book years ago, Let My People Go Surfing. That's great. Can you build your wellness program around this idea of let my people go surfing? I mean, from the outset, it's not make my people go surfing, it's let my people go surfing. So we're tapping into our deepest human needs there, providing some autonomy there. But it's also so wonderfully captured. Let my people go surfing is like, this idea of being out in nature. It's this idea of I'm thinking about my people, but I'm also thinking about my environment. And I'm also connecting to a deep purpose here. And one of my favorite parts of writing Workplace Wellness That Works is the conversations that I had with people. So I had been enchanted by Patagonia for a long time. And so I actually called up Patagonia and I was like, hey, can I talk with your wellness person? And, and the guy started laughing and he's like, we don't have a wellness person. In fact, we don't have a wellness program. But I guess I can talk, connect you with our teams guy and he can talk with you about it. So the point being is that wellness and well-being were just so much a part of the culture and the way of life that they didn't even need to have a standalone wellness program. And my hope is that one day that all of us are superfluous, because this just becomes a way of life. It's not a standalone program. So I like to start from that more holistic way, which is how do we think bigger picture around how do we do things like optimize the environment and culture so people don't even think about it when they come to work. They're just naturally pushed toward the healthy choice. So if we think about blue zones, for example, it's not that people in blue zones are that much more motivated than the rest of us, or they've gotten that many more incentives than the rest of us. They just happen to be lucky enough to have been born into a blue zone. I mean, come on. So how does every organization learn from that? How do the leaders from that learn from that? How do we as activators learn from that so that we can create our own version of a blue zone? And by the way, I'd love to mention, I'm going to be interviewing next week, 1 week from today, your keynote speaker from your last National Wellness Institute conference, which is Dexter Sherney. So I'll get to ask him more about that. I'll put it in the chat. So I'd love for you all to join me in that conversation. So that is a kind of a very long-winded way of responding to that question of yours. But again, if you want to get decision makers on board, number one, they're super busy. So dumb it down, make it super simple. Think of 1 or 2 choice stats that you want to share, but really hit them over the head with lots of stories. They love stories. And then remind them, speak to their ego also, like, don't you want to be a forward leading leader like the next Yvon Chouinard? I can help you to become the next Yvon Chouinard. And here's how.
And don't be afraid to play that ego, right?
Right, exactly. Yeah. I mean, it's human nature.
Absolutely.
So, yeah.
So let's take it just one half step further. We've got CEO leadership on board. We know that staff wants it. They've been wanting it for decades. Frontline supervisors, department heads, how do we combat those folks from making sure that they understand that this is not a frou-frou, nice little thing that all of a sudden everybody's getting to take some time off from getting their widgets done? What can we do there?
I'm so glad you asked about that. This is my favorite group to speak to. I actually just, spoke to manager yesterday. I'm getting ready to work with Tennessee Valley Authority, actually through Michelle Clark, who I met through National Wellness Institute through their annual conference. Thank you so much. Getting ready to launch 37 workshops with all of their managers and leaders. I'm so excited. And I've now trained over 15,000 managers around the world. Love this group. So what typically happens is that we get the trendsetters on board. So these are the senior leaders. They're the ones who set the tone across the organization. They're the ones who allocate resources. They're the ones who are the decision makers. They're like, okay, great, we'll do this wellness thing. Then what typically happens is that they go straight down to people like you and me, the activators. And often we're the ones, like those waiters who have like 50,000 mugs of beer that they're having to carry. They've got like all these things that they're carrying, and then they have somebody say, okay, now you're going to do wellness on top of everything else that you're already doing. Oh, and by the way, you're going to get zero respect and you're going to get zero resources. So have at it and have fun. Oh, and by the way, we're going to expect some hard data showing that it's actually effective. And if it's not, then we're going to cut the program. And meanwhile, we miss out on that middle level. So while the senior leaders are the trendsetters, I call the managers, that middle layer, the permission givers. So what standing data from Gallup, we also have our own published data around the impact of empowering managers to become what we characterize as multipliers of well-being. This creates a positive ripple effect. So the manager, if you empower them to become that multiplier of well-being. So whether or not wellness is part of the job description, every manager is in fact uniquely positioned within the workplace to either persuade or dissuade their team members from engaging with their well-being. So according to Gallup, the manager alone likely accounts for up to 70% of the variance of their team members' engagement, both with their work as well as their well-being. Or for every hour that a manager engages in after hours email time, that likely translates into an added 20 minutes of after hours email time for their team members. Or a study from Sweden found that if you have a negative boss, your chances of having a heart attack today and 10 years out dramatically increases. So this is not meant to scare managers, but instead to tell them you have a choice to make, which is, are you going to put your head in the sand, pretend like this wellness stuff doesn't matter? Or are you going to put on your cape and become this agent of change, this multiplier of well-being for your team? And you can do this very simply. If number one, you do it yourself, you lead by example. Number two, you talk about it. That is, you speak. And then number three, you create systems, team-based systems that help to normalize well-being within the context of your team, such as having meeting starters, like we named 3 good things at the outset of the meeting. Or as a manager, I'm thinking about appreciating my people, not just for what they do, but for who they are as human beings. But it's really about a mind shift from just self-care to team care, self-care to team care. And again, the manager is at the helm of that.
Laura, I really wish you would show us some passion that you have in this space. It's been such a boring, lowly, monotone kind of conversation. Sorry, I had to go there. All right, we're at the end. Unfortunately, the 347 other questions that have come in are just going to have to unfortunately wait till the next time we talk. What's the one?
Chuck, I did put in the link to my conversation with Dexter, if anybody would like to join.
Good.
And I'm always happy to have ongoing conversations with people. I'm really active on LinkedIn, Instagram, Twitter, but also I'm only one email away, laura@motioninfusion.com, or even one phone call away, 415-310-5505. And I just want to say, Chuck, National Wellness Institute has been my North Star, my home base for so long. I am deeply indebted to you, to Lana, to everybody at the National Wellness Institute. And I want to really thank you all for the leadership that you all have been providing for a long time and continue to. And again, not only the leadership, but also just really giving a home base for all of us. So thank you so much for that.
Thank you, Laura. What's the 1 or 2 things you want to leave everybody with?
So my final thoughts is in a society that values individualism, perhaps above all else, it is no wonder that we have framed up the pursuit of better health, wellness, and well-being as an individual pursuit. But if there is anything that we have learned from the pandemic and all that has come with it, it is that my health, my wellness, my mental health, my well-being matters to you and yours matters to me. There simply is no me without you, and the only way forward is together.
Laura Putnam, thank you so much, my friend, for your time today. I miss getting to talk to you more often, and this is just a reminder that we just have to keep conversating over and over again.
Thank you, Chuck. Thank you, Lana, and thank you, everybody else.
Thank you, everybody, for being here. Our next one is February 16th. It is with what I jokingly call as one of my Beatles of research. It is Dr. Jim Harder, the chief scientist researcher for Gallup. He's the one that wrote the Gallup Wellbeing book. He also wrote the book that you actually showed. So please join us for Jim Harder in February. I look forward to it. Have a good night.